girl gang, it's Dr. Joy here and you are watching Delivering Joy MD. And today we are continuing our Super Mama Summer series. And we're going to be talking about hacks to live your best life during pregnancy. Today's video is all about hacks for common discomforts in pregnancy. A lot of women express that they feel some discomfort during their pregnancy, some of which are just actually normal pregnancy discomforts. So today I'm going to be giving you some hacks, tips, and tricks on how to get through pregnancy. Make sure you keep on watching. Okay, girl gang, let's jump right into this video. So I'm going to be giving you some tips, tricks, and hacks on how to survive each trimester of pregnancy with your sanity intact. A lot of women report many different discomforts during pregnancy, and many times they're really just worried and anxious about whether or not these discomforts are normal. And many of them are, but there are some warning signs, which we'll talk about in our next video. And so today I'm really going to give you some comfort tips on the normal discomforts during pregnancy. So let's start out with first trimester. First things first, right? So a lot of women early in the first trimester may report cramps or pelvic pain. And so one of the things that I really recommend is heat. So heating pad in your lower abdomen, warm baths with Epsom salt. These are all good ways to get rid of those annoying early first trimester cramps as the uterus, which is a muscle, starts to expand with the growing pregnancy. It is not normal to have cramping and bleeding. That's something that you want to notify your OB provider about right away. Nausea and vomiting is another huge thing that a lot of women experience in first trimester. And most of the time it has to do with the pregnancy hormone levels being pretty high during first trimester. So, women will experience this feeling of nausea, and sometimes they're vomiting a lot. So some women can really have severe nausea and vomiting. And so if you're one of those women who has severe nausea and vomiting, something definitely that you want to discuss with your OB provider in terms of getting prescription medications, maybe even some home nursing visits. We use a service in my practice called Optum that comes out and does IV fluid hydration and can help deliver around the clock anti-nausea medicine with pumps. But if you're just kind of having the run-of-the-mill morning sickness where you're just a little bit nauseated and maybe have some vomiting at one point during the day, then there are a couple of really all-natural hacks that I really love for this. One is ginger tea or ginger candies, and some essential oils that can be used for anti-nausea properties. I know I am a huge fan of essential oils and I use them for a lot of stuff. Just thinking about what you're eating. So a lot of times women have cravings for all sorts of weird stuff, or they may have no cravings at all. But one of the things that you want to do if you're having a lot of nausea and vomiting is avoid spicy foods, greasy foods, and fried foods, because those increase the amount of acid that your stomach is making. And so then when you throw up, you're getting a lot of acid, and that really irritates the tube that takes food from your mouth to your stomach, called the esophagus. And so women who are throwing up a lot may actually see a little blood in their vomit, and that's just really because the esophagus has gotten so irritated that the skin on the inside of it is having little tears and cracks, and so you'll see some bleeding with vomit. And so if that's happening, you definitely want to let your OB know about it, but it's nothing really to be alarmed about unless you're seeing a lot of blood in your vomitus. Some women are going to require hospitalization for nausea and vomiting, and like we said in previous videos, nausea and vomiting can really increase your risk of having problems with your electrolytes. So if you're not really able to tolerate solid foods, but you can tolerate liquids, make sure you're drinking plenty of water, Gatorade, Powerade, Pedialyte, whatever sort of sports drink that you like that has some electrolytes in it. Another thing that I hear a lot is that we don't have an appetite in first trimester. This really worries women for some reason. They're just like, oh my God, I don't feel like eating. I'm forcing myself to eat. And what I always say is that first trimester is a little strange in terms of the taste buds and food smells sometimes, and you're just not really feeling like yourself and you don't have your regular appetite. So what I always recommend is eat what you can tolerate. There's a special diet that we have called the BRAT diet, which stands for bananas, rice, applesauce, and toast. I don't know who would eat all that in a combination, but basically what it is soft, bland foods that you can eat that should not really make you very nauseated, and that should keep you, getting some nourishment. I really recommend small, frequent meals. So maybe a half a sandwich here, a cup of yogurt there, a smoothie or a milkshake if you really just don't feel like eating. We want to eat what we can tolerate. And as long as we're tolerating liquids really well and we're getting some extra electrolytes, I'm totally okay with that. And so we expect a little bit of weight loss in that first trimester. A lot of women will lose some weight, but remember, 10 to 15% of our body weight is too much. So if you notice that you're losing a lot of weight, you need to talk to your OB provider about that. Smells, can be a little bit difficult to deal with, but one interesting thing that we have found since we've been in this coronavirus pandemic is that a drop of peppermint oil, like essential oil, in your mask really helps a lot with smells. So if smells are bothering you, you can either put a drop of peppermint oil on your mask if you're wearing a mask, and I hope you are, or just right here in your Cupid's bow, right above your lip. And so that helps for you to just be able to smell that particular scent and not smell other scents so strongly if you're having a problem with smells. Fatigue is another big issue that women have in first trimester. And for this one, I always recommend, especially if you're having nausea, that we do some B vitamins. So vitamin B6 is really helpful for nausea, but the B vitamins are also really helpful to boost energy. Exercise is another great way to boost your energy, even though it seems kind of counterproductive. Since you're tired already, why would you want to exercise? But actually, exercising releases endorphins, which are chemicals in our brain that give us more energy. So try that. And then of course, just give yourself some grace. Take a nap if you need to. Sleep more. Make sure you're getting at least 7 to 9 hours of sleep per night. Get it now, girl, because once the baby's here, it's going to be a lot more difficult. Second and third trimester kind of have some of the same common discomforts, and so we're gonna just kind of group those together and hit those one by one. So round ligament pain is one of the biggest ones. I usually start seeing this in women who are in, like, say, weeks 15 to 28. They first start to really feel this pain in their groin area, and sometimes the round ligaments are really tender to touch. Now, if you remember, we talked about round ligaments in our second trimester video, and the round ligament is the ligament that stretches from the top of the uterus all the way to the pelvis, and it actually inserts in the pelvis right above the vagina. So a lot of women get what's called lightning crotch, and it's very painful. It's like a sharp shooting pain that kind of takes your breath away. It is really usually due to the baby moving so much inside the uterus, and that ligament is kind of trying to hold the uterus down in the pelvis while the uterus is stretching up and into the abdomen. And so it's kind of like a tug of war that's going on in there. So that round ligament pain can be pretty painful. I again recommend heat. So heating pads are perfectly okay to use. If you don't have a heating pad, my number one hack is to get like a face towel and get it damp, not completely soaking wet, but just get it damp, squeeze it out, put it in the microwave for about 1 minute. And then when you take it out, shake the steam out and just put it right underneath your tummy. And that is where those round ligaments start to insert. It's right there. And that moist heat is really helpful to kind of relax them. You can also use things like icy hot. Sometimes I will use topical solutions to help with that, like different rubs, like Tiger Balm. It is a ligamental pain, just like you pulled a ligament in your leg or in your ankle or your arm. So it is a ligamental pain, and that will be very helpful. Push come to shove, you don't have any of those things on hand, 2 extra strength Tylenol is a great way to kind of get rid of some of that pain. And I always talk to women about doing yoga. Yoga has some great benefits in pregnancy, but it also has a lot of poses and stretches that can really help with round ligament pain, with sciatica, which is pain that is shooting down the lower back into the back of the legs and causing leg weakness, and it helps with low back pain. So I really recommend yoga because it helps you stay active, and that releases endorphins that help you feel more energetic. And these poses can really help to alleviate some of the common ligamental and back discomforts that we have in pregnancy. It's also totally okay to take warm baths with Epsom salt, and I really highly recommend it if you're still at a point where you can safely get in and out of your tub. Some women are like, I just can't get in and out of that tub safely by myself, and I don't want to fall. And so we definitely don't want to have falls, but if you feel confident getting in and out of the tub, warm bath with a half cup of Epsom salt is a great way to relieve some of that low back pain, pelvic pain, and round ligament pain. One other thing that I really highly recommend is a belly belt. So they have these maternity belts, and I really love those. And depending on what kind of insurance you have, you may actually be able to score one of these for free. So ask your OB provider about it. There's a company that we use that usually will ship it directly to your door along with your breast pump if you're planning on breastfeeding, which we hope you are. A belly belt just kind of helps to lift the weight of the pregnancy and the uterus off of your pelvic bones, and it also helps to support your low back. So on days when you know you're going to be up, you're going to be busy, you're going to be walking around, this is the perfect day to wear your belly belt. So getting a belly belt, you can get them from Amazon. I'll post a link to one that I really like a lot and recommend to my patients in the description box below. Magnesium is also great. So a lot of women who are having back pain, pelvic pain, sciatica can really benefit from a magnesium supplement. I use one called Natural Calm, and I'll post that link in the description box below. But magnesium is also really great for muscle cramps. So if you find that you're getting Charlie horses or muscle cramps in your legs or your low back, even around your rib cage, this is a fantastic supplement that helps keep you from having those spasms in your muscles. Also, one of the biggest things that women often are not really aware of is that they need to hydrate. You must hydrate. Speaking of hydration, let's get a little hydration. Water is so important. So I really advise my patients to get at least 64 ounces of water and some Gatorade or Powerade or Pedialyte or Body Armor or whatever sports drink you like, because those electrolytes are really important to keep normal during your pregnancy. When you get dehydrated, you'll experience more round ligament pain, more muscle pain, and more irritability in your uterus. And irritability in the uterus is basically a muscle spasm. So like we talked about, the uterus is just one big muscle. And so when you get dehydrated, the uterus kind of just starts to do this kind of spasm that can be really painful and sends lots of women to the ER only because they're dehydrated. So don't let that happen to you. Make sure you're drinking water, all right? One of the things that I get a lot of questions about is pregnancy massage. And I am a huge advocate of massage and of chiropractic treatments in pregnancy if they are done by people who are skilled in providing these services for pregnant women. So your OB provider may have some recommendations for these folks, say a massage therapist or a chiropractor. I have a great chiropractor who's very skilled in working with pregnant women, and so I refer women to her a lot for back and pelvic pain. I also will refer women to pelvic physical therapy if you're having a lot of back and pelvic pain, or if you feel like you're having some hip instability, which can certainly happen. And I find in my patient population that most of the time It's usually in that third or fourth or fifth pregnancy that we deal with the most pelvic and low back pain. So physical therapy is a great way to learn some of those exercises, but you can really get a lot of those exercises on your own by doing yoga. And so I'm going to post some of my favorite yoga videos that I send to my patients down in the description box. Headache can be a really tricky thing in pregnancy. A lot of women who have history of headache or who get menstrual migraines may notice an increase of headache during pregnancy because we have a huge surge in the hormone called progesterone or progestational hormone. And in some women that does cause some pretty severe headaches. One of the things that I always tell my patients is that if you have a severe headache that does not go away with rest or Tylenol, and you are over 20 weeks along, then you want to check your blood pressure. We know that there is a condition called preeclampsia, and we'll talk more about this in our next video, but making sure that blood pressure is less than 140 for the top number and less than 90 for the bottom number is really important if you've been having persistent headaches. If your blood pressures are normal and you're continuing to have headaches that don't really go away with rest or Tylenol or deep breathing exercises, which I think are so super important, then we need to definitely talk to our OB provider about that. So in terms of deep breathing, I always really advise getting into a dark, quiet space when you can, and actually taking some slow, deep, intentional breaths. So you want to try to inhale for 5 seconds and exhale for 5 seconds. And oxygen really helps to improve headache pain, believe it or not. So when patients come into the ER to see me, I always give them a little bit of oxygen in the little nasal cannula, little thing that goes in their nose, and that can help tons. And so there are some prescription medications that are available for you to get for headaches, especially if you're suffering from migraines that last for days at a time. We have some prescription medicines that are okay to take in pregnancy, and your OB provider can help you get those if you need those. But remember, headaches can sometimes be warning signs. So always mention that to your OB provider. Like, hey, I've been having a lot of headaches, and I'm finding that these headaches last for days, because there are a few rare conditions that we want to make sure that we're ruling out. And so we'll talk about that some more in our warning signs video, but I want to make sure that people are aware of headaches and making sure that you're keeping track of your blood pressure if you're over 20 weeks. And also, even if you're less than 20 weeks, if you've had a history of high blood pressure in the past, you want to know what that blood pressure actually is. Swelling is another huge thing that we see a lot in pregnancy, and it happens quite often. Pretty much all pregnant women get some swelling. If you don't, you're a lucky girl. But because of the uterus sitting on those big blood vessels in the pelvis, like we've been talking about, that inferior vena cava, that inferior vena cava's job is to bring fluid and blood from the lower half of your body back to your heart. So if that blood flow is kind of interrupted by the weight of the pregnancy sitting on those big blood vessels, then swelling is bound to occur. So I see lots of women with little sausage toes because they're swollen, and the swelling may go all the way up to the knee. Now, what I really recommend for this is first thing in the morning, as soon as you roll out of bed, put on your compression socks. And compression socks are like nursing socks. And I always try to keep a pair on hand for patients who need them, because they can be a little difficult to find, but you can find them on Amazon, and I'll post a link down below. They can also be kind of expensive sometimes, but you can wash them and wear them. They're very durable. I wear compression socks when I'm doing surgery all day, just because I know I'm going to be standing up for 10 or 12 or 14 hours. So the more we stand up, the more we sit up, the more our legs swell, especially in pregnancy. So those compression socks just help to keep your legs from swelling. The other thing that I always talk to my patients about is a good solid shoe. Whenever people's feet are swelling, they tend to want to wear flip-flops and sandals, but that just gives the foot more space to just swell to its maximum capacity. So by wearing a compression sock and a good closed-toe shoe, you can really help to stave off some of that swelling. And so if you know you're going to be busy and out and about, put on a sneaker or, you know, a good shoe that's going to give you some arch support, and also that will keep your feet from swelling to like hugeness. So want to consider putting the legs up, elevating the legs up at a level that's above your heart. So I always tell my patients, like, lie down on the couch when you get home and, you know, you notice that your feet and your legs are swelling, and actually prop those legs up on the end of the couch while you're lying flat. That just helps to kind of pull some of that fluid out of the lower half of the body and help it kind of drain back to those large blood vessels by gravity. So if you are in mid or late third trimester, you may want to just lay on your side and actually prop your legs up with some pillows, and that can be really helpful as well. Heartburn is another huge thing, and oh my God, y'all. So did you know that they actually did a scientifically proven study that women who have heartburn tend to have babies with more hair? I was like blown away by this. I mean, I know it's kind of like off topic, but it's so cool to know that science backs up some of the things that our mothers and our grandmothers told us many years ago. So heartburn can be very common. It usually starts in second trimester, and that is really just because the muscle that holds the stomach closed gets kind of loose, and it's not really on its job during pregnancy. And the other thing is that the uterus is kind of getting up and into the abdomen, and so it's pushing against the stomach, and the stomach just makes all kind of acid. So when you lay down, the uterus presses up against the stomach, that muscle is weak that's holding the stomach shut, and so that acid is allowed to just kind of roll right back up your chest. And so there are a few hacks I have for this. One, again, avoiding spicy, greasy, fried foods, because those tend to increase the amount of acid that you're producing. Two would be to elevate the head of your bed to 30 degrees. So maybe if you are just a one pillow sleeper, you may want to add another pillow just to kind of give you, raise your head and your neck up a little bit to keep that acid from just rolling straight back up your esophagus, or the tube that is taking food from your mouth to your stomach. One patient told me about this teaspoon of mustard, yellow mustard. I haven't tried it yet, but several people have sworn by it. So I don't know, try it out if you're adventurous. And then the other thing is that there are over-the-counter medications that you can take, like Tums, Rolaids, Prilosec, Pepcid, Nexium. These things are all safe to take during pregnancy, and they can also be prescribed by your OB provider if you're having a problem with constant heartburn. The thing to remember about these types of medications is that if you're taking them, you want to continue taking them, because once you stop taking them, the stomach starts producing acid again, and then you're right back in the same boat. So you don't want to stop them, when you feel better. Now, Tums or Rolaids are just for, just to kind of quell symptoms of heartburn, and you can totally use those with a Prilosec or a Pepcid if you need to. One of the other final discomforts that I hear a lot about in second and third trimester is what we call carpal tunnel. So carpal tunnel, you may have heard of before, and it's where there is just irritation and swelling at the wrist. And there's a little tunnel under which your nerve that supplies most of your hand runs, and that's called the carpal tunnel. In pregnancy, this nerve tends to get swollen, just like many other things on your body. And so you may notice numbness or tingling in your fingertips. You may notice that you just feel like your hands are completely numb. And this is usually the sign I get when people have carpal tunnel. They're doing this all the time, like, oh my gosh, my hands are asleep. And so for that, I really recommend the soft wrist splints that are available in many drugstores and grocery stores, and you're going to wear those especially at night when you lie down and go to sleep, and that can kind of help. Now, if you're having severe carpal tunnel, you can't hold things, you're constantly dropping things, you can't hold your fork, or in one patient's case, she was an assistant who was doing procedures with a doctor and was unable to actually hold the instruments. If you have a severe problem like that, it is certainly possible for your OB provider to refer you to the orthopedic specialist, and they can do some injections that help to get rid of some of that swelling around that nerve. So you definitely want to speak up if that's something that's really bothering you and kind of affecting your everyday life. Braxton Hicks contractions. This is something that women really get like nervous about. So the uterus, again, is a big muscle and it starts to have some spasms. So after 30 weeks, you may notice these tightenings or Braxton Hicks contractions. They're usually not super painful, although some women do report that they're pretty painful and they, can cause, some distress. But Braxton Hicks contractions are like practice contractions. The actual definition of labor is regular contractions with cervical change. And with Braxton Hicks contractions, you may be having tightenings or even feeling what feels to be more painful contractions, but they're not actually changing your cervix. They're not causing cervical change. So that's what we call false contractions. One of the quick ways to test as to whether or not you're having real contractions versus false contractions is lie down. Lie down, put your feet up, try to go to sleep and relax. Usually Braxton Hicks contractions will feel better once you're rested. Now, real labor contractions will not allow you to rest. You feel better when you're up, walking, moving, and that's kind of a quick and dirty way to tell. But if you have questions, you're confused, not really sure what's going on, there is always the opportunity to go into labor and delivery and be checked out. One of the things that I really recommend if you're having a lot of Braxton Hicks is check your hydration. So I tell my patients, drink 2 bottles of water and have a snack. And then I tell them to lie down and rest. Or if they want to have a Tylenol, that's totally okay. Or even a Tylenol PM, that's Tylenol plus Benadryl, and that should help them rest. Now, I don't care what you do, baths or heating pads or snacks or hydration. If you're in real labor, it ain't gonna stop. And if you feel like you're in labor, if you've been having strong regular contractions for an hour that you can time, that are coming really close together, like less than 10 minutes apart, then you may just wanna go in and be checked. Another real important hack that I have for that is don't let sperm in the vagina. 2nd and 3rd trimester women can definitely have sex, and there's no problem with that at all. But you may want to practice the withdrawal method or use condoms during the 2nd and 3rd trimester of pregnancy, because sperm has a protein in it called prostaglandins, and prostaglandins will cause you to contract. So you want to try to avoid that at all costs. I can't tell you how many women I see in the OB emergency area and they're like contracting, and you can actually see on the monitor that they're contracting. Well, the first question that a lot of the labor and delivery nurses will ask is, have you had intercourse in the past 24 hours? And then you get this, yes, ma'am. And you realize that that's really the cause of the contractions. And we're able most of the time to stop those and get you a lot more comfortable just with some hydration and sometimes with medication to help relax the uterus. So these are my tips, tricks, and hacks on how to live your best pregnancy life through all trimesters. If there's something that I didn't hit here that you really want to talk about, definitely post that in the comments below and we can have some convo about it. And make sure you hit the subscribe button so that you catch all the rest of our Super Mama Summer series and lots of other great women's health tips. So I'll see you soon, girl gang, in the next video. Peace.
See you soon, girl gang. Don't forget to subscribe and comment below.